Hey friends, happy EDS and HSD Awareness Month. Today I'm going to be doing a Q&A answering your questions all about the Ehlers Danlos syndromes and hypermobility spectrum disorder. I was diagnosed with hypermobile Ehlers Danlos syndrome in 2016 and I'm here to share all the knowledge that I have gained on the topic in the last 8 years. But as a quick disclaimer, I'm not a medical professional. These questions I'm answering, the answers are all based on my personal experience and understanding. I really hope that some of my answers to these questions help you wherever you are on your EDS and HSD journey, or it tells you a little bit more about the conditions. What is EDS and HSD? EDS, or Ehlers Danlos syndrome, and HSD, or hypermobility spectrum disorder, are connective tissue disorders which vary in rarity and severity. Connective tissue is the stuff that makes up our body. It makes something called collagen, which is the glue that holds all our joints and parts of our body together. So it makes up a lot of our systems. But with people with EDS and HSD, that is faulty, meaning the glue that holds our joints and other bits together doesn't work so well. So it can lead to joint instability, joint hypermobility, and other issues with injury and skin fragility. There are 14 different types of EDS, all of which are genetic, but the only one that doesn't have a gene to identify it just yet, but research is ongoing, is hypermobile EDS. And hypermobile EDS is going to be mainly what I'm talking about today because that is the version of EDS that I live with. We're also going to be talking about HSD because it's quite similar to hypermobile EDS. What's the difference between hypermobile EDS, hypermobility spectrum disorder, and joint hypermobility syndrome? First of all, joint hypermobility syndrome and Ehlers Danlos syndrome type 3 are outdated terms that are no longer used and relevant, or shouldn't be, even though some medical professionals still do. If they're still using them, get them on the up-to-date terms. From my understanding, hEDS and HSD are very, very similar, both in terms of symptoms and management. However, the main difference from my understanding is genetics. hEDS is based on the 2017 criteria that the Ehlers Danlos Society brought in order to do research on the condition, because much more research is needed before a full diagnostic criteria can be established. HSD is essentially anyone that still has symptomatic joint hypermobility but doesn't necessarily fit the full criteria of hEDS, which also includes things about skin fragility and other marfanoid traits. Unfortunately, people who are diagnosed with HSD are having a bit of a difficult time in terms of insurance and access to treatment because some medical professionals mistakenly think that it's milder than hEDS, which is simply not true and damaging because they're both a spectrum and you can have very, very severe HSD and much less severe hEDS. How did you get your diagnosis of EDS? So my diagnosis wasn't straightforward. I don't think anyone's is, and I had never ever heard of EDS or HSD or any kind of hypermobility syndrome before I was diagnosed. Basically what happened with me is that it all started with a CSF leak, which is a complication that can be caused by EDS, where basically the layer around your brain is too fragile and can break spontaneously. So that's what happened, and we spent a lot of years searching for answers on these headaches mainly. I then developed POTS and became very bedbound with that, and I started losing a lot of muscle because I was very strong. I was a badminton player. And all of a sudden, my joints had always been unstable. You can see it looking back from my childhood. Once you know about EDS, you suddenly see it through your whole life. But it was only when I was deconditioning with POTS that my joints started to become much more painful and unstable, and that's when I started having things like subluxations. Basically, I was very lucky after being sent to several doctors that had no idea what was wrong with me. I was sent to a neurologist who spotted my CSF leak, POTS and EDS all in one appointment, and then I was sent to various specialists to go and get those diagnoses confirmed. Usually EDS is diagnosed by a rheumatologist or by a geneticist, depending on which type you have, and depending on the specialists available in your area. And if you want to look at specialists that are available in your area, charity EDS websites are the best place to look for that, such as the Ehlers Danlos Society or Ehlers Danlos Support UK. Have you always had EDS? So EDS is a genetic condition, so yes, I've had it since I was born, and once you know about EDS, you can kind of see the signs throughout your childhood that no one ever put together before. For example, I was a very colicky baby. I used to get a lot of injuries like sprained ankles and bruises all over me. I had headaches and joint pain from a very, very young age, but I didn't know that that wasn't necessarily normal because it was blamed on hormones or my diet or various things. It wasn't until my late teens, mainly when I went to university, that things became more of a problem for me and that my condition became more disabling until I was eventually diagnosed when I was 21, and it's continued to kind of be as disabling, if not more disabling, ever since. How does EDS affect you? EDS affects me all day, every day. It's mainly chronic pain and chronic fatigue that are my biggest issues, as well as joint instability, which can include subluxations for me. I don't usually fully dislocate, but I have done on occasion. Brain fog. EDS is multi-systemic, so can affect a lot of different systems within your body. So for me, that's mainly my neurological symptoms like headaches and CSF leak that I've had in the past and various other neurological issues. I can get nerve pain. I also experience gastrointestinal issues and issues with my autonomic nervous system, and that's just to name a few. It can literally impact any part of your body, so the symptom list can be pretty endless. What are the most common comorbidities and complications of EDS and HSD? So one of the most common comorbidities is POTS, or postural orthostatic tachycardia syndrome, which is a form of dysautonomia, which affects all the things that your body does automatically, like heart rate, blood pressure, digestion, that kind of thing. Another condition called mast cell activation disorder, or MCAS, is a really, really common one, and that is a condition which basically causes a lot of allergy reactions, but seemingly to not very much. I only have it extremely mildly myself, so I don't really know enough in depth to talk about it, but I'll put some information in the description if you want to find out a bit more about that. Chronic fatigue is another really, really common one. It's something that I experience a lot, and I'm not necessarily sure if it's my EDS or my POTS or the combination or other things that is causing it, but being in pain all the time is obviously extremely exhausting. Mental health issues are often really, really common in the EDS and HSD community and in the chronic illness community at large, because it's difficult when you're struggling so much with a condition and with your body and you don't know what's going on and medical professionals don't know what's going on, and there's not as much support as there should be from people around you. So anxiety, depression, all that kind of thing is really, really common. And also it's been shown recently with research that's ongoing that there is a really high prevalence of neurodivergence among the EDS and HSD community. We don't really know quite what the cause is there or how it's how that's come about, but that's also really prevalent at the minute. So things like autism and ADHD are really, really high within the community. As I spoke about as well, a much rarer complication is having a CSF leak, but that's something that I've had in the past, and you can also have a lot of gastrointestinal complications. I know friends with various feeding tubes and colostomy situations because of their gastrointestinal issues. What type of pain do you feel and how would you describe them? So there's way too many to count, to be honest, but some of the main ones, especially with someone with chronic pain, are kind of like the burning, hot pains, and I get a lot of nerve pain as well, especially in my legs. I'm always kind of achy and tight and sore. It's kind of like if you've worked out after having not worked out for ages, and then you're recovering the next day, but we kind of always feel like that, or I do anyway. Then there can be like really intense stabbing pains that come out of absolutely nowhere and you have no idea what's going on. I also get some really like deep, intense, heavy pain where like organs or certain bits of my body feel like they're in a vice. I I can get quite a lot of like acute pinching type pain around my joints if they're being really unstable. Yeah, there's so many different types of pain that I experience, and the thing is as well is that you can have a combination of all of those different types of pain going in your body all at once. It's not fun. What are your top EDS hacks? I actually have a whole video just based on EDS hacks, so if you really want an in-depth explanation, go and look at that video. But I have some of my favourite bits and pieces here. I have a lot of hand hacks because I struggle with the hypermobility and instability in my hands a lot, and it causes a lot of pain. So I've got things for the kitchen, like this automatic tin opener, which is not just loved by me, it's loved by everyone who comes and cooks in this house, from my partner to my support workers. And I also have this cool ergonomic L-shaped knife, which I find much easier on my joints rather than trying to put pressure on them the normal way. I have a whole bunch of different supports. The ones that I use most regularly are my hip support shorts from DMO Orthotics. Those are really, really great. I've got a huge collection of mobility aids. I have walking sticks, I have rollator walkers, I have wheelchairs, I have mobility scooters. I have everything, and I'm planning on doing a full mobility aid collection video soon. If you would like that, please let me know. I also love a pillow. With EDS, comfort is key. So this is my full body pillow that I sleep with every night. I absolutely love it. It's my favourite thing in the world. There's actually another one behind me right now. I always have cushions and pillows, and I have various other little pillows as well. So definitely go and check out either the YouTube video or my website, which I'll link down in the description, so that you can find out a bit more about EDS hacks. What is the best advice for someone who has been newly diagnosed with EDS or HSD? One of the things that I definitely wish that I'd known about sooner when I was diagnosed with EDS was that there is this amazing supportive community out there. And yes, people with EDS and HSD are a big part of that, but also people with other chronic illnesses and disabilities. And I've learned and grown so much from being a part of this amazing community. So I definitely recommend that you become part of it. Sometimes community can be difficult because some places on the internet can get a bit dark and trauma dumpy. So find spaces around disability and chronic illness that make you feel good and make you feel seen and make you feel like you're able to relate to what's going on. Because that comes on to my second point of that you need to know that you're not alone, because you're not. Even with the rarer types, yes, there's very few people with the rarer types, but there are other people that you can connect with across the world. And I've made so many amazing friends with all different types of EDS and HSD from literally across the world over the last 8 years, and it's been beautiful. So I recommend finding that. I also recommend that you go easy on yourself. This is a piece of advice that I need to take myself still, but go easy on your body, go easy on your mind. It's very difficult when you have a condition like EDS that often means that you can do things in the moment and then you have to like pay fun tax essentially, and you get hit with all the symptoms after you've done something good or something fun. So be gentle with yourself. Try not to blame yourself too much. It's not your fault. Be gentle with yourself. And I think the final kind of piece of advice that I would give is that you will adapt. It's probably really, really hard right now dealing with a new diagnosis, potentially having no idea what that diagnosis means. It might mean that your future looks very different from how you thought it would. I know that when I was diagnosed, I had to leave university and have surgery, and it was all very scary, and I didn't know what I'd be going back to because I was doing drama at university. And yeah, my life now is not the life that I thought I might have. But I have a beautiful home, I have a beautiful partner, I have a beautiful dog, I have a great job doing disability advocacy and education and working in content creation. And yeah, it's not the life I expected, but it doesn't mean that it's not a good one. How do you explain EDS or HSD to those around you? So with strangers or acquaintances that might ask questions and you don't know them, you don't need to give them the time of day if you don't want to. I spent a lot of energy when I was first diagnosed over explaining my conditions, and I found it really exhausting, and I found that you don't have to do that. You know, just share what you want to share. I just say I'm disabled if someone asks what's wrong with me. You don't have to go into a super amount of detail. The next thing to tackle is if you work, and how to kind of disclose it with colleagues or management. And in this case, again, I over-explained way too much in the beginning. And now I prefer to talk about my access needs as opposed to my medical condition. So I will share with colleagues or anyone that I'm working with what I need. So for example, I'm a wheelchair user, so I need ramps and I need an accessible building. I also need more water breaks, and I need to be cool. So I explain the things I need as opposed to how my condition affects me. With friends and family, you obviously might want to give a bit more of an explanation of what's going on in terms of medically. And that's actually how I started this YouTube channel in the first place, was so that I didn't have to keep explaining. I just had a video that I could send them to explain my condition. So either you can make your own little video or blog post or something that you can send, or you can direct your friends and family to a website or this video if you want them to learn more, just to give them a bit of a better idea and understanding of what you're going through. Then with closer friends and family, like people you live with, for example, your partner or your siblings or your parents, I think it's really important to have an open level of communication, because even 8 years into my EDS journey, I'm still learning about things that I struggle with and what makes it easier for me. So things like writing a flare-up plan is a really good idea. My support worker Poppy's laughing at me because I said that I would do one for her, and I haven't.
It's on the to-do list.
But just making sure those lines of communication are really open, and you can say how you feel and what's affecting you. And again, you can give them all the same information that you give further away friends and family, but they're the ones that are going to see you at your worst more often. So I know that reassuring them that this is normal for you, even if it seems very beyond normal, is very important. How can I support someone with EDS? So if you have a loved one that has EDS or HSD, talk to them, because everyone is so individual, because there's such a wide variety of symptoms and severity of them, and some people will have more symptoms in one area than another. For me, when I'm feeling emotional about the whole situation, I just need people to listen so I can just get it out there. I really don't like it when people try and fix the problem, because there isn't a problem to be fixed. It can't be fixed. You can't take this condition away from me. So if I haven't asked for help fixing an issue, then try not to offer too much advice, and just listen and say, yeah, I know that's rubbish. Also, if you are planning any kind of social event or outing, make sure that you include them and think about their access needs, whatever those may be, and make sure that the activity is accessible as well. And if this person can't leave the house, for example, maybe think about going to them and finding an activity that you can do in their home together. On a physical level, it's great to ask anyone who you think might be struggling if they need help, but just don't get offended if they say no. They might be practicing a new skill. I've had it a lot recently with my manual wheelchair, whereas I'm practicing where it looks like I'm struggling, and I don't need help, but it's nice for someone to ask, because I'm unlikely to ask for help myself if I actually do need help. What should I do if I think I might have EDS or HSD? If you think you might have EDS or HSD, the first thing that you should go and do is consult your doctor. If you have suspicions that you might have EDS or HSD, I recommend that you go to the Ehlers Danlos Society website and print off the 2017 diagnostic criteria, because that will give your GP or the medical professional in front of you a really good idea of what they're actually looking for. Then if they're not specialist enough or don't know enough, they can refer you to the correct specialist. Usually with hypermobile spectrum disorder or hEDS, this is more likely to be a rheumatologist, and if it's any other type of EDS, then it's usually a geneticist. But hEDS can be diagnosed by a geneticist as well. The other piece of advice I would give is to look on either kind of Facebook support groups or on Instagram, or over on EDS Society or the Ehlers Danlos UK or other EDS charities support pages, websites, because they often list lots of different medical professionals in your area that have an understanding of EDS and HSD, so you know who you're trying to go to, because that was one of the things I definitely found when I was being diagnosed, and when I was looking for more support after being diagnosed, I was sent from my GP to my local rheumatologist, who kind of said, well, there's nothing more that we could do. But because I'd spoken to EDS UK, I was able to say, actually, I know of this programme at RNOH and the Royal National Orthopaedic Hospital, and they can help me. Can you refer me there? And that's what they did. So knowledge is power. So bring stuff with you and find out who is the person to see in your area. Can you have EDS or HSD without getting subluxations or dislocations? The simple answer is yes. Subluxations and dislocations aren't actually part of the diagnostic criteria for EDS or HSD. Obviously, they're very, very common, and it's more about joint instability than necessarily full dislocations or subluxations. For example, I'd never had a joint go out of place that I knew of before I was diagnosed. It was only after deconditioning further that my joints started popping out of place much more often. Where can I find support as someone with EDS or HSD? As I was just mentioning, the EDS charities that exist, in America it's mainly the Ehlers Danlos Society, but that is international, and in the UK there's EDS Support UK, but there are various other charities depending on what country you come from. They often hold regular support groups, whether that's online or in person, in different areas, and also they have message boards and things on Facebook groups where you can join and get support from others going through similar things. Another great thing to get support from people who have lived with this condition is online communities. I do have my own Facebook support group, which is linked in the description if you want to join that, and also follow me on my Instagram pages. We have a lovely community over there, and I hope to get a little community back here on YouTube. So if you want to introduce yourself in the comments and people can reach out to you, then you're more than welcome. In terms of physical and medical support, again, you can often get big lists of the specialists in your area on EDS charity pages. They're really, really helpful, and you can also ring their helplines, and they are really good at telling you the right direction that you need to go. Obviously, it's really specific to your area, so I can't give too much specific advice, but for me, I know in the UK the main centre for helping out with EDS or HSD tends to be the Royal National Orthopaedic Hospital in London, but there are other centres in the country. It's just a case of knowing who is best to see, and you can often find that in your community support. So I really hope that you find the support that you need. Thank you so much for watching my EDS and HSD Q&A for EDS and HSD Awareness Month. I really, really hope that you found it useful. If you do have any more questions, please pop them in the comments below and we will try our best to answer them for you. Thanks again so much for watching. I hope you learned a little something. I'd really love it if you could drop me a like and hit that subscribe button, and I am Chronically Jenny all over social media if you want to find out more. I talk about disability hacks, mobility aid tips, and general disability education. Thanks again for watching, and see you soon for another video.